So yesterday we tested our health care program here at the home once again, or our health insurance. As our one of our volunteers, our summer interns, was injured using a planer, and so we responded quickly. I always wondered why I was in EMS when I was in and when I was in rescue when I was in college, and now I understand. So I was able to quickly package him and prepare him. The problem was we weren't sure where to take him. The last couple of days, we've been having this ongoing conversation with both Paul and Dakota about um, health here and what the National Hospital entails. And was telling him, if you need blood transfusion, you need blood, you have to go outside the hospital, find people standing around who will offer to sell you blood. You have to buy your own materials. You have to buy, syringes or maybe surgical equipment. That's just kind of the norm. And so I knew I didn't want to take him to the National Hospital, but I wasn't real sure. I called our local doctor and he wasn't responding. So I called our surgeon. He wasn't responding. So we have another friend who was our doctor, but now he's in government. And so I called him and said, "Help! What do I do?" And he said, "Hang on, let me call another friend who's a surgeon." And so the system worked because we were able to get to a hospital, get to a doctor and a surgeon who could take care of it quickly. So we don't have health insurance per se, but what we do have is we do have connections. We have people who support us, who know who we are, who want to help the home, and who are willing to do that for us and take care of these problems and issues when they arise, which don't arise too often, thank goodness. But yesterday was one of those days we were able to use that. God's given us those connections with people who can help us and support us when we're in an emergency or in need of urgent care, which is what happened yesterday. And it all worked out. Paul's doing better. His arm looks much better than it did at the start. And so it all came together. I tell people we have the best health insurance anywhere, better than any program I would say in the United States, and it all cost us like $50 is what it ended up costing us, and you can't get that anywhere else, I don't believe. So God provides.